This poll is a little bit sobering, and I feel a little bit like the designated driver at the party, but I think we need to look at the facts squarely. President Obama's top priority now is ensuring everyone and restraining the growth of health care costs. But as the August deadline approaches and legislation begins to specify who will win, who will control, who will pay more, most now oppose the proposed public plan released yesterday by the leaders of the House of Representatives. And they oppose the mandates, the taxes, the individual components of the plan, and the plan in aggregate. Is the air coming out of the balloon, or is it just a case of cold feet before the wedding? Here are the findings. 84% are satisfied with their health care, although 79% agree that rising health care costs are hurting business. 53% believe health care to be a human right. 46% support President Obama's belief that you need a public plan to, quote, keep insurance companies honest. If you remove his name from the question, the support actually falls a bit. Should we require everyone in the country to have health insurance and offer some federal help for those who can't afford the premiums? 22% agreed. Should we require all employers to offer insurance choices and to cover most of the costs as they do now? 2/3 agree with that. 3, should we provide health insurance for everyone in the United States on a single-payer program similar to Medicare? 25% agreed. Overall, then, Americans are in favor of improving care and generating economic savings by incentivizing best practices. They want the system put on a diet. They want an exercise regime before resorting to surgery. This stepwise approach would delay covering the uninsured. Congress may be able to win over an increasingly skeptical public or pass legislation without broad support leading from the front. That concludes my remarks. I'd like to turn it over to Mr. Zogby and then open up questions for ourselves and the panel. Thank you very much. We'll probably have, I think, the biggest legislation since 1965, but I don't think it'll be as sweeping as the House bill. I think this 42% support is going to be a little sobering and will embolden the Senate Finance Committee to find a middle ground. Hope so. As a patient and a doctor, I hope so.